Ladies and gentlemen, please welcome Mr. Steve Lieber, President and CEO of HIMSS.
Good morning. Thank you very much, and welcome to the 2012 mHealth Summit. It's great to see so many of you here at the opening session of this fourth annual event. I know in talking with several of you, there are those that have been here since the very beginning. It's my first time at the summit, and I'm overwhelmed by the magnitude of this event. For those of you that remember 4 years ago, when it was a very small group of a few hundred very dedicated advocates from the mobile health IT world, you too, I'm sure, are just amazed at what's happened in just a very few years. As I say, I'm pleased to welcome you to this event as we prepare for 3 days of networking, learning, and exchanging ideas all around mobile health and its important role in the patient care continuum. We've seen impressive growth in all areas of the summit since last year. As of this morning, we have more than 3,800 registered attendees and 300 companies populating booths and themed pavilions in our expanded exhibit hall, and a very impressive lineup of sponsors, including our returning partnering sponsor, Verizon. While the number of people who have joined us this year is important, we must look at the demographics to truly judge what's happening with this summit. In addition to having all 50 states represented, we have delegates from 54 countries who are also joining us this year. The mHealth Summit remains the largest event of its kind and is truly a global convener of the mobile health ecosystem. The summit being in December gives the mobile health world a chance to come together and reflect on what the year has brought us in mobile health, and more importantly, what's to come in the year ahead. To make both this reflection and this advance look forward possible, we have partners that play critical roles in helping us to define and deliver this event. The Foundation for National Institutes of Health, the mHealth Alliance, and the National Institutes of Health, who together with the Trans-NIH mHealth Interest Group have developed the research tracks once again this year. They all join our own mobile initiative, mHIMSS, to make what we think is an absolutely perfect partnership. This allows us to bring together research, practice, and industry to truly look at all facets of mobile health technology. During the next few days, you will hear from well-known and visionary speakers who will highlight critical progress, research, use cases, success stories, and lessons learned from across the mHealth landscape. The exhibit hall will offer you a first-hand look at mobile health technologies that are in use now and offer important health IT solutions to bring mobile IT into the mainstream of patient care. Also take note of the themed pavilions focused on gaming, aging, chronic disease management, startups, and wireless health in general. The mHealth Summit offers an attendee mix not available anywhere else. Use this opportunity to forge new relationships, gain a better understanding of the mobile health ecosystem, and to network with your peers, health IT professionals, C-suite executives, policy experts, and representatives from research, academia, and technology arenas, as well as other key areas of healthcare from around the world. As a mission-driven, not-for-profit organization for almost 52 years now, HIMSS has now introduced our mHIMSS initiative at this conference. It is a platform for all stakeholders within the mobile community to drive positive, transformational change in healthcare and healthcare through the best use of IT. Our mHealth initiative focuses on the use of mobile and wireless technologies to promote health and build on the existing HIMSS strengths of convening stakeholders, sharing knowledge, providing world-class education, public policy, research, and content entirely focused on the use of mobile technologies. Today, we released the results of our 2012 mHIMSS Mobile Technology Survey. We are also announcing today an interactive online tool, the mHIMSS Roadmap, to help navigate the many nuances of mobile health. I mentioned these just to highlight some of the activities at HIMSS around mobile technology. Finally, I want to take a moment to make a personal comment and recognize an individual and a team who were behind not only this year's summit, but the previous one as well. Rich Scarfo, Vice President of Events with the HIMSS Media Group, and his team of 3 other individuals truly are the brains and the brawn behind this summit, and I want to thank and recognize that group for once again producing a world-class summit. Now I'd like to introduce a featured addition to our keynote lineup, Dr. Patricia Michel. Patty was a speaker at the first summit in 2009 and is now the executive director of one of our organizing partners, the mHealth Alliance. Her passion for gender balance, global health, and supporting underserved communities around the world is apparent through her and her organization's contribution to the program. I'm grateful that Patty is able to join us this morning, as she and the mHealth Alliance are critical components to this event. Please welcome Dr. Patricia Michel.
Good morning, and welcome to the 2012 mHealth Summit. This is the 4th year that the mHealth Alliance has been a partner in organizing the mHealth Summit. We're here because, like you, we believe that mobile technologies can be a catalyst and accelerator for improving health and well-being. In developing countries where the mHealth Alliance focuses its efforts, the average doctor-to-patient ratio is 1 doctor for every 250,000 patients. Yet these same countries account for nearly 80% of all mobile subscriptions worldwide. In fact, many more people now have access to a mobile phone than clean water, electricity, or a bank account. For people everywhere, a mobile phone can provide life-saving and health-enhancing benefits. Throughout the world, mHealth projects and platforms are maturing toward scale. As a global mHealth community, we have made significant strides and laid solid foundations to foster innovation and scale, yet important work remains to be done. Last year at the mHealth Summit, the mHealth Alliance charted a course to facilitate the mainstreaming of mHealth to address global health challenges and improve health outcomes, specifically by working on issues such as evidence, standards, sustainable financing, policy, and capacity in this quickly moving field. As an international health specialist who has tenaciously promoted the strategic use of mobile phones for health in developing countries for more than 10 years, yes, 10 years, I can assert with great confidence that mHealth has transitioned from a novel idea to a strategy for global health. Increasingly, organizations, ministries, and movements are looking to better leverage mobile technology to accelerate their efforts and to reach people that they could not reach before. We are seeing great progress in the growth and rigor of mHealth evaluation and greater attention to standards. Today, the World Health Organization in Geneva is hosting a high-level consultation on standards and interoperability for e-health. At this year's mHealth Summit, we welcome you to join us for the inaugural Global Health Track, where much of this progress will be featured and where I hope connections will be made to build on existing momentum. This track was designed by the Alliance in collaboration with 16 of our partners to whom we are indebted. 2012 was a breakthrough year. More traction and momentum was gained in 2012 in mHealth than any year prior. The Every Woman, Every Child catalytic mHealth funding mechanism, supported by NORAD and implemented with the World Health Organization, was launched and has since awarded over $3.4 million in grants to 16 organizations to promote scale and collective learning. Joined together, these grantees are aiming to reach 1.5 million mothers and children, 6,500 health facilities, and 100,000 health workers. In 2012, the mHealth Alliance became Partnership Secretariat to the Mobile Alliance for Maternal Action, also known as MAMA. Funded by USAID and Johnson & Johnson and in collaboration with Baby Center and the UN Foundation, MAMA has made groundbreaking gains in the use of mobile messaging to improve maternal and newborn health. Today, MAMA's adaptable messaging is being used in 40 countries and reaches approximately 20 million moms. In October, MAMA was chosen from among 1,700 nominees for this year's Fast Company Innovation by Design Award in the Service Design category. Similarly, USAID and the mHealth Alliance have joined forces to form a 3-year public-private partnership called Empowering Frontline Health Workers to improve maternal and child health by accelerating the use of mobile technology by millions of health workers around the world. Our founding members include UNICEF, the Frontline Health Workers Coalition, Qualcomm, Vodafone, Intel, the MDG Health Alliance, GlaxoSmithKline, the PreKelt Foundation, and Absolute Return for Kids. For me, 2013 is the year for scale for mHealth. I am pleased to announce that the mHealth Alliance has forged a new partnership with the Nigerian Federal Ministry of Health and Intel to leverage mobile computing and telecommunications technologies to support Nigeria's plan to save 1 million lives, an initiative launched in October by Nigerian President Goodluck Jonathan. The aim of the initiative is to end by 2015 the nearly 1 million deaths each year of women and children in Nigeria by preventable causes. The mHealth Alliance will lead activities related to promoting the enabling environment for mHealth, including assessing existing implementations, strategic planning to align technology with health targets, and advocating for the application of supportive standards and policies. I would like to thank Rich Scarfo and his team at HIMSS for making this event year after year the leading U.S. and global event for mHealth. Many thanks to the mHealth Alliance team, partnership board and advisors, and the UN Foundation, our gracious host and champion, for your collective dedication in supporting all the great work the mHealth Alliance does. In conclusion, I invite you to join us in our effort to scale mHealth in 2013, either by becoming a member of the mHealth Alliance or partnering with us on one of our many initiatives, so that ministries of health, NGOs, corporations, academic institutions, bilateral and multilateral organizations and donors can accelerate their efforts to promote healthier societies through mobile technology, so that families and health workers have the information and tools they need when and where they need them the most, and that 1 million lives, or maybe even more, can be saved. Thank you. I would like to now introduce our next speaker, Dr. Roderick Pettigrew. Dr. Pettigrew is the first director of the National Institute of Biomedical Imaging and Bioengineering at the National Institutes for Health. In previous positions, he was Professor of Radiology and Medicine at Emory University, Professor of Bioengineering at the Georgia Institute of Technology, and Director of the Emory Center for MR Research and the Emory University School of Medicine in Atlanta, Georgia. Dr. Pettigrew is a member of the Institute of Medicine and the National Academy for Engineering. Please join me in welcoming Dr. Pettigrew to the stage. Thank you very much.
Good morning, everyone. On behalf of the National Institutes of Health, it is indeed my pleasure to also welcome you to the 2012 mHealth Summit, now in its fourth year, as you have heard before. The NIH has been an organizing partner of this summit since its inception, and we continue to be impressed with the strong enthusiasm nationally for the considerable opportunities that mobile and wireless technologies offer to improve health. As you know, the NIH works to discover fundamental knowledge about the nature and behavior of living systems and to apply that knowledge to enhance health, to lengthen life, and to reduce the burdens of illness and disability. The commitment of the NIH to improving public health through scientific research includes leading the development and the application of new technologies at the most innovative edges of science. Mobile and wireless systems applied to health are certainly such emerging technologies. These provide new tools for research, clinical diagnosis, disease management, healthcare decision support, and importantly, patient participation. This summit not only provides an opportunity to showcase technological advances, as we're well aware, but it also provides an opportunity to accelerate the critical evaluation of these new technologies so that we can determine what their utility is, what their value as a whole is, as we all work to improve the health of the nation. As in previous years, the NIH has been instrumental in coordinating the research track consistent with our mission. This includes a range of presentations addressing the investigations in the areas of preventive health, chronic disease management, and diagnostic and therapeutic tools. I hope you will avail yourselves of the opportunity to hear from researchers who will be reporting at this summit on their studies to evaluate the use of mobile and wireless technologies. In addition, a number of NIH institutes and centers are represented in the NIH Pavilion in the exhibit hall. And in addition to that, we have NIH program staff who are available to discuss your ideas, opportunities for funding, and this includes both academic and business-based researchers, and to highlight some of the research that has been supported by the NIH in the effort to develop and apply these technologies appropriately. Again, on behalf of the NIH, it is my distinct pleasure and privilege to welcome you to mHealth Summit 2012. I hope you will have a stimulating and an informative meeting. And I also hope that you'll have some time to enjoy the local area, particularly given the excellent weather that we ordered up for you. Thank you very much.